Hello my dear curious and studious students of surgery, myself Dr. Mahesh Chaudhary. I am warm welcoming you in my surgery lecture series. This surgery lecture series contains entire surgery with anesthesia, with radiology, with orthopedic. So stay tuned with us. Let's start our surgery lecture series. Welcome dear students. In my surgery lecture number 80, that is the common tumors and miscellaneous lesions of the skin. In this lecture, we will see the teratoma, benign tumors, malignant tumors, comparison between benign and malignant tumors, various types of the malignant tumors, difference between benign and malignant tumors, etiology of the malignant tumors and spread of the malignant tumors. All point is covered in this lecture. Now start with me the common tumors and the skin lesions, miscellaneous skin lesions. First we see the definition of the tumor. A tumor or neoplasm is a growth of new cells proliferate without relation to the needs of the body. The most important two processes which play part are abnormal reproduction and abnormal differentiation. First is a metaplasia. It is a condition in which there is a change in one differentiated tissues so that it resembles another type of similar differentiation tissues. Second is a dystrophy. This is a disorder usually congenital of the structure of function of an organ or tissue. Dyscrasia literally means a bad mixture and is now used only by haematologists to describe any blood disorders of uncertain etiology. Third is the anaplasia. A malignant tumor consists merely of a diffuse mass of irregular cells which do not resemble any normal tissue. And next is the teratomas. These are the tumors arising from totipotential cells, that is the cells capable of differentiating into any of the tissues of the body. So representatives of each of three germ cells, that is the ectoderm, endoderm and mesoderm, must be present before a teratoma can be diagnosed. The tumors are broadly divided into two groups. One is a benign, that is the innocent tumor, and second is a malignant. Benign tumors well circumcised and possess capsules. Benign tumors never metastasize. Second is the malignant tumors. The hallmark of malignant tumors is invasiveness. It is this infiltrative capacity which gives it is the name of cancer. The crab, excluding the locally malignant group, are all malignant tumors metastasize. Dear students, here is the image of the teratomas you can see on your screen. This is the another image of teratoma. Now, a comparison between the main features of the benign and malignant tumors are given as below. In benign tumors, the age may occur at any age. In the malignant, it is usually seen after 40 years. Size in the benign tumors are usually small size but occasionally enormous, and the size in the malignant is usually of large size. Benign growth, slowly growing, expensive type of growth. The progress of growth is erratic with a tendency to cease. In the malignant growth, rapidly growing, invasive type of growth. The progress is usually relentless until death occurs. And fourth, in the etiological structures in the benign neoplasms, it is well differentiated, well formed stroma with little tendency to hemorrhage and necrosis, cells regular and few mitosis. In the histological structures of the malignant tumors are less well differentiated and sometimes completely anaplastic. Stroma often poorly formed, hemorrhage and necrosis are common, cells are often pleomorphic, mitosis often numerous. And fifth point is the fixity in the benign tumors are usually not fixed to the surrounding structures, and the fixity in the malignant tumors are usually fixed to the surrounding structures due to the local invasion. And sixth point, in the benign, the surrounding structures are not involved, and in the malignant tumors, involvement of the surrounding structures is a characteristic feature. That is, in case of the malignant tumors of the parotid glands, the facial nerve is often involved and paralyzed. 7th point, in the benign tumors, that is, the benign tumors usually do not show tendency towards the hemorrhage and ulceration. 7th is the malignant tumors show more tendency towards hemorrhage and ulceration due to the increased vascularity. 8th point, of the metastasis in the benign tumors, metastasis never occurs, and the metastasis in the malignant tumor metastasis frequently. 9th point is the cause of death in the benign tumors usually not fatal. If death occurs, it is due to the mechanical pressure of obstructive effects. Endocrine aderomata may have hormonal effects. And the cause of death in the malignant tumors almost invariable, fatal if untreated. Cause of death, a combination of the mechanical and destructive effects together with blood loss, secondary infection and starvation, etc. Now the various types of the malignant tumors are like carcinoma in situ. When a malignant tumor has no invasion, the lesion is called carcinoma in situ. Locally malignant tumors, these tumors show prominent local invasion but distant metastases are insignificant. Dormant cancer, rarely cancer may remain dormant for some times, even for a few years, after which they suddenly grow aggressive. These cases are called dormant cancers. Latent cancer, the typical examples of this condition is prostatic cancer. It is a relatively uncommon disease. Now, the different varieties of the benign and malignant tumors are: first is the tissue of origin, benign and local, malignant and malignant. First, epithelium, the original tissue of the origin is the epithelium, covering and productive epithelium. First, in the epithelium, squamous cells, benign squamous cell papilloma develops and malignant squamous cell carcinoma. In the terginal epithelium cells, benign terginal cell papilloma and terginal cell carcinoma in the malignancy. In the tissue origin epithelium, columnar cells are there, columnar cell papilloma and adenocarcinoma in the malignant cells. Second is the compact secreting epithelium. The epithelium benign neoplasm develops the adenoma if cystic and cystoadenoma or papillary cyst adenoma, and where the malignant of the compact secreting epithelium develop the adenocarcinoma if cystic and cystoadenoma carcinoma. Other epithelial tumors include the local malignant are basal cell carcinoma, salivary and mucous glands tumors, carcinoid tumors, agent epinoma, urgent epinoma. These are difficult to classify in terms of behavior. Now, the second is the connective tissue origin, that is the fibrous tissue. Benign is a fibroma and malignant develop the fibrosarcoma. Nerve sheath connective tissue, benign neoplasm is neurofibroma and malignant is neurofibrosarcoma. Connective tissue of the fat tissue, benign is lipoma and malignant is liposarcoma. Connective tissue of the smooth muscles, benign neoplasm is leiomyoma and malignant is leiomyosarcoma. Striated muscles in connective tissues origin, benign is develop the rhabdomyoma and in the malignancy rhabdomyosarcoma. Synovium connective tissues, benign tumors is the synovioma and the malignant tumor is the malignant synovioma. In the cartilaginous connective tissues, the benign tumor is the chondroma and malignant is the chondrosarcoma. These are the difference. Now, in the bone, the tissue is the bone and osteoblast. Benign tumor is osteoma and malignant is osteogenic sarcoma. Osteoclast is osteoclastoma and malignant osteoclastoma. Tissue of origin is the connective tissue, again mesothelium develop the benign tumor is mesothelioma and malignant tumor develop the malignant mesothelioma. Blood vessels and lymphatics, benign tumor develop the benign hemangioma and lymphangioma, where the malignant blood vessels of the lymphatics are develop the angiosarcoma, lymphangiosarcoma. Meninges, the tissue origin from the meninges, that is the benign meningioma and the malignant is malignant meningioma. Neuroglia, tissue origin is the neoglia. Benign tumor develop the astrocytoma, oligodendroglioma, ependryoma, and the malignant tumors malignant ectoderm, oligodendroglioma and ependyoma, where the chromaffin tissues, the original tissue is the chromaffin tissue, develop the benign tumors of the carotid body tumors and the malignant is the malignant carotid body tumor. Next is the lymphoid and lymphopoietic tissues, that is the benign lymphoma and the malignant tumor is the lymphosarcoma, reticulum cell sarcoma, Hodgkin's disease, follicular lymphoma, multiple myeloma, leukemias and polycythemia vera. Fetal trophoblast origin from the tumor, benign tumor is the hydatiform mole and the malignant tumor is the choroid epithelioma. From the embryonic tissue, the totipotential cells develop the benign teratoma and the malignant tumor is the malignant teratoma. Pluripotential cells, that is the kidney and liver, develop the malignant tumor is the neuroblastoma and the hepatoblastoma. Now the next is the tissue origin is the unipotential tissue, that is the retina, malignant tumor develop the retinoblastoma. Hindbrain, that is develop the malignant medulloblastoma. Sympathetic ganglia and the adrenal medulla develop the ganglioneuroma, that is the neuroblastoma. Next tissue origin is the embryonic vestiges, develop the from the notochord, the malignant tumor is the chordoma. Enamel organ, tissue origin is the enamel organ, the locally malignant is the adenomantoma. Pituitary residues, from the tissue origin is the parapituitary residues, the local malignancy is the craniopharyngioma. Brachial cyst is there and the malignant tumor is brachydactylic carcinoma. Now the tissue origin is the hematoma, that is the melanotic. Benign tumor is benign melanoma and malignant tumor is the malignant melanoma. Angiomatous tissue origin is, and the benign tumor develop the benign angioma and malignant is the angiosarcoma. Exostosis and achondrosis develop the malignant tumor of the chondrosarcoma, neurofibromatosis benign is neurofibroma and malignant neurofibromatosis tuberous sclerosis tissue origin develops the benign tumor is a glioma and malignant tumor is malignant glioma. Now the etiology of the malignant tumors are the cause of the cancer is not known. A few factors are often incriminated to cause cancer, but the cause is not one for all cancer. Cigarette smoking is often held responsible for cancer of the lung, but it has got nothing to do with malignant melanoma or cancer of the breast. Hydrocarbons. First etiology of the malignant tumors is the hydrocarbons. The chemical compounds responsible to initiate carcinoma is the polycyclic hydrocarbons. A hydrocarbons benzopyrene was isolated from tar and showed that it had a high degree of carcinogenic activity. Another of the carcinogenic hydrocarbons is the chloranthrene group. The aniline dye cancer of the urinary bladder in which the carcinogen is a beta naphthylamine. Now the next etiology of the cancer is sex hormones. Due to the structural resemblance between the carcinogenic hydrocarbons and the female sex hormones, there is a possibility that these hormones may be carcinogenic. Estrogens does not act on the skin, but it acts on the mammary epithelium, which is normally under the influence of ovarian stimulation. In normal women, the output of the estrogen is rhythmical, though it is said that when the supply is constant and prolonged, cancer may result. Next etiology of the cancer is the radiation. Various forms of the radiation may act as the carcinogens. The early workers in the X-ray department suffered radiation dermatitis followed by the cancer of the skin of the hand after many years. Cancer of the thyroid has also developed long time after irradiation of the neck for some other reasons. Now the next etiology of the cancer is the viruses. The tumor develop when the animal reach early adult life. He described an agent transmitted through the mother's milk which was responsible for such mammary cancers. He described it as a transmissible milk factor which is nothing but a virus. Now the co-carcinogens etiologies like hereditary, chronic irritation, trauma, diet and geography. Whatever may be the carcinogenic agents, there may be some factors which help the cancers to develop. A match may start a fire but the material must be inflammable. A little clamp on high breeze may extinguish the flame. The various factors which probably help carcinogens to form cancers are heredity. Majority of the cancer patients give familiar history. A familiar tendency is always noticed. Second is the chronic irritation. Radiation is an irritant causing inflammation, but it is also a carcinogen. And third is the trauma, which is important. Next is the diet. Thiamine deficiency may activate the virus, which may be a carcinogenic one. Fat cooked at high temperature might have a carcinogenic properties. Always remember, high temperature cooking is a carcinogenic property. Next is the geographically etiology, which is secondary. Incidence of the certain cancers is very high in a few countries. Cancer of the liver is a rare disease in most countries, though it is a very common in Java and South Africa. Now the final point of this lecture is the spread of malignant tumors. Infiltration into the surrounding tissues is a silent feature of all malignant tumors. The invading cells come across various natural passages which then afford an easy route for the malignant cells for further spread. The most important structures involved in this way are the lymphatics and blood vessels. In both of them, the malignant cells are carried to distant sites. If these cells survive and multiply, a distinct mass of the tumor is produced at this distant site. This is known as a metastasis. Various routes of spread of malignant tumors are local or direct spread, invasion by lymphatics, through blood vessels, through serous cavities, natural passage and inoculation. Now the first type of the spread of malignant tumors are local or direct spread. Direct infiltration of the surrounding tissues is a characteristic feature of all malignant tumors. This means that the microscopic extent of the malignant tumors is more than its microscopic extent. The cancer cells are amyloid or motile. The cancer cells are free because of greatly reduced adhesiveness, which in turn seems to be due to the deficiency of calcium in the cell membrane. The invading cancer cells tend to follow natural clefts or tissue planes and gradually move in the line of the least resistance. Dense facial sheath may form barriers which confine malignant cells for some time. This is a well-known fact in case of the osteosarcoma, where the periosteum resists cancer cell to invade surrounding soft tissues from quite sometimes cartilage is also resistant to tumor infiltration. Now the second route of spread of the malignant tumors are invasion by the lymphatics. Carcinoma shows a particular tendency to invade the local lymphatics at an early stage. Carcinoma cells rapidly enter lymphatics and pass through lymphatics by either permeation or embolism. Permeation is the growth of column of tumor cells along the lumen of the vessels. Lymphatic permeation may cause local thermal edema, which produces the pudgy orange appearances in the breast cancer. The cancer cells stimulate the perilymphatic fibrosis, but this does not stop advancement of lymphatic permeation. Embolism. The spread of the carcinoma cells along the lymphatics by embolism. The regional and distant lymph nodes are early involved by the process of the lymphatic embolism. Now the third route of the spread of the malignant tumor is the spread through the blood vessels. Malignant cells invade small vessels or venules, become detached and are then carried by the bloodstream to some distant site, where they come across a capillary network. At this site, the emboli becomes impacted, proliferate and develop into the secondary tumor. Four groups of the veins may be invaded: the systemic veins, pulmonary veins, the portal veins, portal system veins. The vertebral systems of the vein of Baston pass up inside the spinal canal and anastomose the sacral, lumbar, abdominal and thoracic veins. The commonest organ in which the blood-borne metastasis occurs in the liver. The next most common site for the blood-borne metastasis in the lungs. First is the liver, second is the lung. Bones are involved third after liver and lungs. Fourth route of the spread of the malignant tumor is the spread through the serous cavities, that is the transcolymic spread. When a tumor invades the serosal layers of the viscus, it causes local inflammatory response with a small infusion in a serous cavity. The cell becomes incorporated into the fibrous exudate and are then detached. They are swept into the effusion. These tumors emboli settle diffusely on its wall, proliferate and set up in seeding. They are swept into the effusion. These tumors emboli settle diffusely on its wall, proliferate and set up in seedlings. In gastric or colonic cancer, there may be transperitoneal spread to the which are known as the Krukenberg tumors. Both ovaries are enlarged with smooth surface and the surface of the ovary is almost replaced by a mass of mucoid carcinoma. Transperitoneal spread occurs in some cases of lung and breast cancers. Now the next route of the spread of the malignant tumors are spread along natural passages or epithelial lined spaces. The tumor cells may be carried along such passage as the bronchus and the ureter to become implanted at the distant site to form a new growth. It is common in cases of papilloma of the renal pelvis, where this tumor may spread along the ureter even into the bladder. Now the next point or route of the spread of the malignant tumors are inoculation. It is well known fact that clumsy surgical techniques may allow implantation of cancer cells onto the adjacent incisor tissues, and it is quite possible that there may be subsequently develop a new tumor. Such spread of tumor can also occur while taking biopsy. In one case, a carcinoma of the breast was removed and the skin flap was taken from the thigh to close the large gap. A few months later, a nodule having the same structure as the breast cancers developed in the scar on the thigh. This may be happen. So always remember this route of the spread of the malignant cancer. Dear students, here is the end of our surgery lecture number 80, that is the common tumors and miscellaneous lesions of the skin. Thank you.